Hi, I am Dr. Sasikanth Maddu. I am a senior consultant plastic cosmetic surgeon in Yashoda Hospital, Somajiguda branch. Today I am going to give you a small talk regarding liposuction. Liposuction is a procedure which has been developed for the past 30 to 40 years and it is one of the safest procedures which has been used to increase betterment of the appearance of the people. So the basic principle of the liposuction is to suck out the fat which is beneath the skin, that is subcutaneous fat, what we say in medical terms. So we use small cannulas, different 4 mm, 3 mm or 5 mm diameter cannulas, and we make small openings on the skin and we introduce these cannulas into the subcutaneous tissue and we suck out all the subcutaneous tissue which is excess in amount from different areas. So we generally mark the specific areas where there is an excess fat beneath the skin and we suck out. Before we start sucking the fat, we usually fill up or infiltrate the fat with a tumescent solution, which is a mixture of a saline solution with local anesthetic solutions and some solutions which make the fat loosen up. So that is called hyalase, or sometimes we use dilute adrenaline solutions. So after infusing the infiltrate or a tumescent solution, the fat becomes a little bit looser and the hemostatic drugs in the solution will decrease the blood supply into the fat, so that the fat can be easily sucked out without much complications or without much side effects. So after the sucking out of the fat, we just measure the pinch thickness of the skin and determine the end point of the suction by determining the pinch thickness of the fat, which should be generally less than 2 centimeters. And after the liposuction, generally the post-operative precautions should be like the person should be wearing pressure garments to contour the fat and to prevent the formation of seromas for at least 3 to 4 weeks, and he can resume his normal duties within 48 to 72 hours after the liposuction. Generally, liposuction was devised initially for improvement of cosmetic appearance of the body by removing the excess fat, most commonly from tummy or buttocks or thighs, and sometimes from arms and as well as male breast reductions surgeries. But this principle of liposuction has been applied into the reconstructive surgery part also, decreasing the flap sizes by doing the liposuction of the fat, and sometimes we even aspirate the fat, small amounts of fat from the thighs or the abdomen, tummy, and process the fat by centrifugation and use that processed and concentrated fat to fill up the defects, sometimes which occur either due to accidents or due to some other conditions where there is contour abnormalities or there is a difference in the filling up of parts of the body, where there are depressions or sometimes congenital problems where there is a difference in the contours of the body on either side. This processed fat is used to fill up the defects and it's supposed to be one of the best procedures for filling up and long-term permanent procedures for filling up the defects in the body. So that's the varied applications of aspiration of fat is the basic principle of the liposuction. Thank you.